Hi, good evening for everyone. Today we meet each other, just talk about dentistry, about at all about medicine. So I'm Dr. Kamilov. I'm working in Dubai. Um, I'm working around for 4 years in Dubai. At all, I have 9 years experience. So here we have a guest, Dr. Sardar, Hamdam, Dr. Sardar.
Yeah, I am. Hi, everyone.
Could you tell about yourself?
Yes, well, I'm a doctor also, but I'm specialized on a urology side. So now we're here, and thank you very much for inviting us for our conversation. Uh, so yeah, let's speak about how the dentistry can connect it with other diseases, uh, especially with the diseases of the rest of the body. And with us here is Dr. Sarwar.
Jumaif Sarwar.
Jumai Sarwar.
Assalamu alaikum to everybody. Thank you for having me. It's nice to see you, Dr. Sardar, Dr. Nuruddin. It was a great pleasure to see you again, even it's for a one time in a year. But, thank you thank you for everyone just for a meeting. Today we have just podcast here, just talk about dentistry, about medicine, and not only about this our problems, our life problems, how we can solve these problems, right?
Yes, totally right.
Yeah.
Yeah. So let's discuss about yesterday you had the one question.
Yes, I had a question actually. I was thinking about why the human being has the 32 tooth. You know, because okay, I can explain why the human being has every organ with a pair, but except the tooth. So was my question actually, and I tried to read something about it, and I couldn't find the proper information about it. Okay, what I did, I find just a couple of hypotheses and the ideas of the dentist doctors. So this is the question both for both of you guys. What do you think? Why we have 32 tooth?
But I will give you an answer. Because the God wants to get dentist rich. That's why. That's my answer.
Um, let me tell about my. Let me introduce my opinion. First of all, we have jaw formation before becoming our first tooth. During the baby growth, we have also jaw formation, and to holding our TMG, temporal mandibular joint, you know, but to holding this all, each tooth playing main roles for holding the jaw, you know. By the time, I mean, okay, let's start how it's starting. First, growing the tooth, okay, growing the tooth, together growing with the tooth, gum and the bone, everything is supporting the tooth, okay. And when we studied together for the information we studied together, we worked together. So on orthodontic courses, we talked about the first molars, like it's number 6 tooth. It's like a key of our occlusion.
Right, that's right.
Yeah, he will agree with that. So it's Allah's create these moments. It's this first molars. It's holding our jaw, our TMG.
I see.
So after that, the first molars is holding the jaw. It's like holding our proper position of our jaw. Just after 7 years, it's starting to grow the first molars.
Okay.
And starting to creating the position of the TMG and holding the occlusion.
Okay.
So and each tooth is playing main role of holding for the chewing, all our patients thinking like we are chewing only just vertically,
Okay.
but our jaw system it's very complicated. So for your question, why we don't have a 20 or 24 tooth, but exactly we have a 32. It's everything because of the holding our jaw.
Okay, I see. So it means if, as you told me before, that our tooth has the places before, I mean, they have format inside the jaw, inside the maxilla and mandibular, right? So they start to grow up after the giving the birth, right? When the baby come out, on the months of 6, right?
Yeah.
The tooth start to
Yeah,
coming out,
yeah.
right? So we can.
You are talking about milk tooth?
Yes,
but
and the milk
temporary
tooth
tooth,
and
right?
yes, temporary tooth,
Uh-huh.
yes, and the all how to say that?
Deciduous.
Yes.
What do you
Temporary
mean?
or what?
I mean the temporary
tooth.
tooth and the another one.
Permanent.
Permanent tooth.
Yes.
Permanent
Yes.
one.
Yes.
So, let's say if the baby has some problem with this tooth inside the mother, it will be effect on his jaw and on his the facial cranium. I mean the facial.
Definitely
mean-
yes. Yeah.
Okay.
Yeah.
You mean during the pregnancy?
Yes, during the pregnancy, for example, the lady give a birth for the baby, and
So if the baby had the problem
yes,
with the
correct. You get my
temporary
point.
tooth,
Yes.
right? And may it cause like problems with the jaw system in the future. For example, if we extract before, the like temporary tooth, may it be cause of the problems of the future jaw problem, right? Like that's what
It might be, but for the jaw formation also it will take a time. Like also orthodontic treatments, like not the braces, like before the brace, some appliance
Just like orthodontic apparatus, right?
Apparatus, yeah.
apparatus.
Apparatus, yeah. Orthodontic apparatus.
Orthodontic and also the orthodontic checkups also it's starting from the 7 years. So before 7 years, it's not important.
So
I will say like that.
Okay, why I give the question? Because as you told me, that the every tooth has its own role on the growing on the growing movement of the joints.
I understand? Yeah.
Okay.
No. I told you about the permanent tooth.
Okay, about
Not-
the permanent tooth.
Yeah,
Okay.
not
so now
about
I
the
get
baby
the point.
tooth. Yeah,
now
yeah,
I
yeah.
get the point.
For the baby, I mean the milk tooth, for the jaw formation, it's not so much important.
Because I want to ask another question: which diseases can cause this case on the baby? So this is both my next.
Yeah, okay, I
You
got your
mean
question.
during
Yeah.
pregnancy or
During the pregnancy? Yes, of
Yeah.
course, during
Yeah,
the
yeah.
pregnancy.
Before the giving the
Ah.
birth. For example, antibiotic, right?
yeah,
Do you remember like tetracycline tooth?
yeah.
So the antibiotics
Exactly.
can
So,
affect,
yeah,
Yeah,
right?
Yeah, the
antibiotics, yeah.
mother took the antibiotics like tetracycline before
Okay.
before she gave birth.
Okay.
So then, when she gave birth to her child, this baby has like black teeth.
Okay.
It's like black lines.
Okay.
This what which the dentists call tetracycline tooth.
Okay.
For,
Okay.
for example.
Okay. So,
So
I
what?
see.
Yeah,
What
this
else?
one, this is such as a lot of disease. It will affect, but not for the jaw.
Okay. not for the
Especially,
jaw.
we will say like especially on the tooth, but usually after changing to the permanent, usually it's disappear these
Okay.
issues.
Okay.
I mean, because during pregnancy, it's only coming formation only the milk tooth.
Okay.
And for the permanent coming after. I
Okay,
cannot say
yes.
exactly which year, but the permanent
it
one,
start-
it's,
yeah,
it's,
yeah, it
it's
start
starting
after.
after
Yeah, okay.
after giving birth. So
Okay. I see. What do you think about it, Sarwarika? Do you have any ideas?
I think that watching for teeth, watching for the tablets which you are taking during the pregnancy, it's really important thing, because nowadays, for example, in Uzbekistan, not every pregnant woman just take these tablets or this type of antibiotics for an important thing. That's why I should tell to everyone just be careful. It's very important thing.
And nowadays, not about the baby. If we will talk about pregnant woman, what do you think, doctor? That which he mentioned about the vitamins, about nutrition, about the healthy food. Nowadays, before our mothers, our grandmothers, I know they had the problem with teeth, they don't have a teeth. We know about it, but in my opinion, their pregnancy period was much better than nowadays.
Yes, I can
So
agree.
what this cause? What's the issue?
What is the difference, right? Before, you mean
Yeah.
what is the difference
What's not?
with the nowadays and the previous generation?
Yeah. Yeah.
Okay.
Okay. The first of all, as all doctors nowadays would say, that the most important is ecology. The ecology and the nutrition itself. The nutrition itself is coming with the gene modification, with the gene modifications.
GNO, right?
Yeah, GNO, yes,
okay,
objects,
I got you.
okay? So, and our parents and their parents used to eat the natural food, okay? And they used to sleep with the sunrise and sunset. This is really important also during the pregnancy. These situations and these how to say these factors can cause you the all the diseases and the especially metabolic diseases because of the only nutrition. And of course nowadays we have a lot of stress and we have that the life is not stable actually.
Yeah.
The
I
life
agree
is
with
not
that.
stable, yes. So that is why yes, in my practice we can see that the young generation couldn't become pregnant in time. So there is infertility.
Yes, and also the one interesting question is about our young patients. I mean, I'm interested that we are living on 21st century, but still we have a bad oral health. So every checkup, Sarwar
So
will,
you mean
Sarwar
young
will
patients
support
like
me.
teenagers,
Yeah.
right?
Yeah, especially
Okay,
teenagers,
okay.
not the adult, especially teenagers. So I think first the problem is a deficiency of vitamin D and calcium, and not healthy food.
Yeah,
Yeah.
I'm totally agree with you.
Especially this beverage like I don't know, cola, Pepsi,
yes.
Sprite, these all things, and
Junk food, right?
yeah, and this how we say this burgers, everything
Yeah,
like
yeah.
Potato
fries,
fry, right?
this everything like
Yes.
chips, everything.
Yes,
You know,
yes.
I have a lot of patients.
What about sweets? Sorry, I break you up. What about the sweets? What about the sugar? Can the sugar affect for this?
Sure, for sure it will affect, because once this one also, this everything it's connected. First, if for example we'll take one option how the cavity is starting. If we will talk about the when only the molar, which we talked before, like first molar only the starting growing at 7 year, our the fissure is too deep.
Okay.
Fissure is too deep, okay, and
Let's
The
say
sur-
let's
okay,
say the whole.
let's say the surface of tooth,
Yes.
right?
surface of tooth, or something like just the surface
Surface
between
of
the
tooth.
tooth is
Surface of your
Contacted tooth, you mean?
jaw tooth, right?
jaw, yeah.
Yeah.
No, or the back tooth.
Okay, back tooth.
Okay.
Back tooth is too deep, okay.
Okay.
So deficiency of the vitamin D, so it means the enamel becoming weak, okay, and baby eating, not the baby, young patient eating something sweet or eating the chips, everything, and everything is stick between, and they are not brushing properly, and everything is stick there.
Yeah. So
Because-
sorry, we coming back to that. The brushing, the hygienic is also
For
dependent
sure.
on it.
For sure,
sure,
yes.
for sure.
For
The
sure.
hygienic, how you
It's
brush
like
your
it's
teeth,
like a basic.
yeah, it's the
It's like
first rule.
it's like a basic.
Yeah, it's the basic and it's the main first rule, because every problem in dentistry, right? It's cause of the bad hygiene. Just the patients cannot properly brush their teeth, and everything starts with plaque of your teeth, with stones on your teeth, and etc. For example, I have an addition for your question, for Nuruddin, about the sweet candies or etc. I don't know when, but I have read an article in Instagram that uh, sweet things like candies, chocolate, and etc. It doesn't cause it carries, because, for example, if you ate something sweet and then you brush your teeth, for example, after 5 or 10 minutes,
Okay.
it's okay.
Okay.
It is not a cause of the caries.
Okay.
But if you, for example, don't properly brush your teeth and then it stays long for a cavity in your teeth, for example, in fissuras, like mentioned Nurda,
Okay.
it will be cause of caries or some problems with the tooth. But
Okay.
if you brush it, for example, quickly, it's okay.
Okay.
It's
I
okay.
see.
I
It's
agree.
like stereotype, like don't eat some sweet, don't
Yeah.
eat candies, don't eat chocolate, and etc. No, you can
Okay.
eat it.
Caries. Okay. Caries itself. It case from some bacteria, right?
Right.
If I know.
Yes.
Right. So.
But there are, some another, for example, another causes too, not
Okay.
only bacterial.
Okay.
Theory.
So, but why I'm asking about bacteria? Because can this bacteria transferred from mother to the kid? For example, because in our tradition, what do we have that our mothers loving too much the kids, when they kissing them too much, they kissing,
Definitely.
directly
Sure.
to the lips.
No, for sure.
So
For sure
what
it
do you
will
think it will
yeah,
affect?
for sure it will affect. For sure, especially when mother has after, during the pregnancy, during this I will say like playing the hormone
Okay.
hormone,
Yeah,
it's
the
hormone,
hormone levels.
hormone
Yes.
levels on the mother, and during this hormone levels it's playing on the body of the mother, also the becoming a lot of the gum diseases.
Okay.
So what it means, if the patient has a gum diseases, so it's swollen, and the patient, especially mothers, they cannot proper clean because it's immediately starting the bleeding. So they are not brushing and flossing properly. So what it means, if they are not brushing and flossing properly, so plaque stick there.
Okay.
First plaque stick there. After this plaque going, this bacteria going to the tooth and starting cavity.
Okay.
So during this bacteria in the mouth of the mother for sure, which you mentioned, she will kiss the baby for sure, and I'm sure that they are kissing to the mouth also,
Yes. Yes. Yes.
and during this kissing, all the bacteria is transferring.
Okay, it means you wanna say that my future wife I supposed to choose with a clean cavity, the oral
For
cavity.
sure,
Yeah.
for sure, yeah, for sure.
I
And
want to
this is
make an
very important
addition.
thing.
Not only bacteria, but virus too. Okay,
Okay.
look back forward. For example, um, even the virus, like we say, herpes simplex.
Okay.
Yeah, it's like, for example, if somebody kisses their child, children, for example, it's a newborn baby.
Okay.
20, 25 days, right?
Okay.
If somebody who has the herpes simplex just give a kiss to this baby, the percent of the
To
you know,
get information.
yeah, to get information from this person who has who kissed this baby girl or
Okay.
baby son, I don't know.
Okay.
It doesn't matter. It's very high
Okay.
risk of the getting this type of virus is very high.
Okay, I
So
see.
that's why my My opinion,
Kiss.
yeah,
Do-
do not kiss your baby, for example,
If you don't have a clean mouth.
for first 40 days, for example, 45 days, like we say, chill in Uzbekistan.
Yeah,
right?
but okay, for why only 40 or 45 days? Our immune system.
That's question for you, doctor.
No. Actually, our immune system, yes, in our tradition we have that. Do not go out for 40 days. Do not go there. Okay, we have the word quarantine, right? Quarantine. So quarantine is come actually from the Italian language quaranti, which means 40.
Yeah.
Okay, and the how to say the ships which was coming inside the Rome Empire. Okay, they supposed to stay before going to the city. They were supposed to stay 40 days
In the ship.
in the ship.
Okay.
Then they let you go out the city, out of the ship inside of the city. So this word quarantine, it comes from Italian quaranti, which is mean 40. Okay, so what I want to
Like
say.
cuando in Spanish, right?
Cuando, yeah.
Okay.
And a question about these 40 days. Why only 40 days? Because our tumor, I mean the thymus, sorry, tumor, I'm saying.
Tumor.
Our thymus, the thymus gland, which is the responsible for immune system. It works until the years 18, 19. So, from my point of view, to have a good immune system, the baby should try everything. Every
Even-
vaccination.
Even the kisses from the person.
Yeah, but
Who
you
has
cannot
it?
accept. You cannot
Okay.
escape this.
Yes.
You cannot. This is life. You cannot
Yeah.
escape this. And maybe for you, dentist, you need to create some, contraceptives for the mouse. Protection
No,
for the mouse.
let me let me tell about from my view
Yeah.
about the transferring the bacteria. So let's go back about our the cavity and the deficiency of the vitamin D and the calcium in our body. So now we talked about the bacteria reaching to enamel and the enamel become more weak and bacteria transferring more deeper to deeper side like our we have two structure we have enamel, dentin and the pulp. First of all, like our enamel, it's like protecting layer, okay, and the enamel is the more hardest tissue in our human body, okay, and
I know
this-
I know the biggest tissue, which is the derma, but I didn't know about the hardest tissue.
no, it's
Okay.
hardest
Hardest, yeah.
tissue.
Yeah, okay.
The enamel is the hardest tissue in our human body. So, and if patient has a deficiency of vitamin D and calcium, this
Deficiency, you mean it's not enough?
it's not enough.
Okay.
Normally, it's it's depending from the 30 to 60,
Okay.
right? In my opinion, 30 also not enough.
Okay.
For me, normal it's up to 60. It's near to 6 or the more. For me, this is a normal. Less 30, it's complicated. It's very less. And 30, 40 for me also, in my opinion, this is not enough for the growing baby. So my point was about the protecting layer. Oh yeah, we talked about the protecting layer, and if patient has a deficiency level of the vitamin D, bacteria can enamel becoming more like I would say more softer,
Okay.
and bacteria can reach the dentin layer much easier. Dentin layer is might be 3 or 4 times is the more softer than enamel. This is another layer. So after becoming the dentin layer, bacteria can reach easily to the pulp, to the nerve of the tooth. So that's why, from my view, it's vitamin D and calcium is playing main role for our tooth. And especially we talked about it's basic about the proper brushing, cleaning, using the
Hygiene.
floss, hygiene. It's basic. It's supposed to be. But
And
the
choosing
level.
the good wife, huh?
This one for sure.
with a,
Yeah,
with a good
yeah.
mouse, huh?
Yeah.
So this is from my view. I mean, you
Okay.
talked about generally
Okay, I
about
see.
the medicine, but this one from my view, how I think about it.
Okay.
And what's our next question? Yeah, we can talk about a very interesting. It's related of our the hygiene. We can talk about the miswak.
Okay.
Miswak is, you know,
Miswak is a tree, right?
it's tree.
Okay, it's tree, and I forget the botanic name of it.
It's not botanic, I think it's Arabic name.
No. There is, yeah, miswak is Arabic name.
No, there is another name too.
No, I mean-
like siwak or what?
Siwak? No.
He's asking the tree name.
The tree
okay.
name
Yeah,
in
tree name.
biology. I mean, in the biology.
Yeah,
I
something.
forgot.
Yeah.
You know.
Me
something
also.
and
Me
me,
also.
you
I
know.
forget. There is one name.
So we can Google it then.
Yeah. Go ahead. Yes. Google it then.
Google the miswak. Okay, so miswak is the miswak is the main advantages of the using the miswak. It's antibacterial effect.
Okay, so it has something
Yes.
which is
Yeah,
antibacterial.
I cannot tell what,
Okay.
but from the
So you mean by
articles-
chemicals, I mean by chemical structure of miswak
naturally.
itself? Yeah,
Naturally,
By
naturally.
by natural and
Natural
chemical
chemicals.
ingredients.
Yes,
Ingredients.
ingredients.
Yeah, which is
Okay.
And
included in
I
miswak.
would say more about there is a natural fluoride. You know what is
Yes,
the fluoride?
fluoride
So
is-
we'll talk later
yeah.
about
which
it.
is making you white, right? The whiteness.
Not the whiteness. It's like we talked about the enamel. It's like I would say like it will make more stronger your enamel.
Okay.
So we will talk about later.
That's
about
a
it.
food for enamel.
Okay.
Uh,
I see.
yes, we
And
will
you are
say
right,
like
and
that.
it makes our tooth more
Whiteness.
white. Yeah, it gives more whiteness.
I see.
Yeah, right.
So with the miswak, you can control if you I will say we can see the our model, right?
Okay.
This is my advice how to use miswak
Okay.
properly. If you will use miswak properly, you can control plaque
Okay.
and healthy gum.
Wow.
But you have to use with the correct way.
Okay.
It's very simple.
Okay.
So on the upper jaw, you have to.
It
This is-
seems really hard, but you're saying it's simple. Okay, go
yeah,
ahead.
it's very simple. You will just take the miswak,
Okay.
and on the upper jaw you will use from up to down.
Okay, so you mean you need to also touch miswak to the gums, right?
Yes.
Yes.
Okay.
Slowly brushing your gums and down.
Okay.
From the up to down, from lower jaw, from down to up,
Okay.
with the touching your gum.
Okay.
Okay,
Just
this
like
is
you're brushing with your
Yeah, with the-
yeah.
Toothbrush.
This is
Toothbrush,
which we say like it's a basic. It's from up to down, from down to up. Upper it's up to down, lower jaw from down to up. With these things, you can control your, which I say, your plaque and your healthy gum. So if patients wants to
So it's much more cheaper to buy a miswak than go to the dentist,
Yeah,
for
right?
sure,
definitely,
yes, for sure.
And we don't. We shouldn't forget about this. It's a sunnah, right?
For sure,
Yeah,
it's sunnah.
yes. We have
Before-
to mention it.
Our Prophet
Because-
Sallallahu Alaihi Wasallam
yeah,
used
yeah,
to say
Salam,
that.
he, before pray, he every time he used it.
Before even the dentist become a dentist, even the like when it was like in 7th century, right?
Yeah, it was
Yeah.
7th century.
In
So
7th
with
century, the
1400 years
effect
ago.
of miswak already was approved.
Yes.
Right? Yes.
Yes.
That's the main point. So that's why everyone can use a miswak for a daily routine.
I see. Pretty interesting, actually. Pretty
Well,
interesting.
Let's talk about hygiene. Dr. Nuruddin, what do you think about hygiene?
Hygiene.
Yeah. For
Hygiene.
example,
I'm
yeah,
sorry.
how
I'm
many-
sorry to breaking you
Uh-huh.
up, but We already talk about that the structure of tooth can be breaked, you know, can be affected to some
Damage,
bacteria,
right?
damage, and you know وهكذا يعني I
Yeah.
mean that to be. Let's say I lose that you lost my teeth.
You lost your teeth
Yes,
or
I
your
did.
or
My
your,
permanent teeth. Let's say
you
I
chip it or you
I mean
lost
I
He's just
chipped, you
lost,
know?
okay.
Yeah, lost.
Extracted.
extracted.
Yes. So
Now the
I
solution.
I love my teeth, but I lost it. Okay.
Yes.
So, what you can suggest me to do?
Nowadays we have only one option: implantation.
Implantation.
Yeah.
Only one.
Only
We don't have
implantation.
another option. So growing your own tooth, it's scientists working on it.
Okay.
I would say, in my opinion, like our near future, like 10, 15 years, we will hope, inshallah. So growing the tooth, it's real. So
To grow the tooth again.
yes, it's real.
But I
Now,
don't believe in this.
I don't believe.
Yeah, being honestly, if you want to get my honest opinion, I don't believe in this.
Well,
everyone-
you know. Listen, here, be careful. Why? I'll tell you why. Because 200 years ago, the people, I mean the humanity, couldn't fly,
Mhm.
right?
Right.
So now we are flying out of space. I mean, we are flying to the space,
Yep.
right? Okay, you can say that this is some natural.
Mhm.
Okay, this is the gut involved, and the human being couldn't.
Yeah.
Yes,
This the
yes,
key
this is
point.
yes the
right.
key point. I'm really totally and definitely agree with you.
Okay.
Okay, but in nowadays, okay, in Islam we say that iqra, right? You're supposed to study, you know,
Yes.
and as much you do, the much Allah can afford you, right? So, stem cells,
Mm,
stem cells,
I agree.
okay. In
I agree
nowadays,
with
the
that.
stem cells are working. They are working.
You mean scientists working on it?
Yes, the
Still
scientists
working
are
on it.
working on it. Okay, and the stem cells in some, okay, for example, in my profession, in my field, okay, of urology, if we have that a man couldn't have the biological
Method.
cells. I mean about this. I'm speaking about the sperm.
Okay.
Okay, the stem
I
cells.
already got it. Okay. Okay.
The stem cells are working on it.
Mhm.
Now, the infertile man can become converted to fertile man. Okay, so this is, I think, in the future, the teeth can be grown also. This is my opinion,
Yeah,
and this is your
everyone-
opinion.
Yeah, this is natural
Yes.
to have the own opinion. This is natural.
Yes, yes.
That's why we are here.
Yeah, that's why we're here.
That's why we are here. Just
Yes.
talking about.
So,
about it.
in the future, if I lose my teeth, maybe you can grow me a new teeth.
Yeah, maybe no. You know why I'm hoping on it. Why? Because the implantation. I agree. The implants nowadays it's a very popular solution, and I would say a good solution nowadays.
Yes.
Because how many years?
Not cheap.
No, you have the.
Well,
implant-
yes, I do. I was
I
maybe I
placed-
was the first. Maybe you was your first
Not first.
patient
Not the
on the
first.
implantation.
No, not the first.
Okay, for me you were the first.
Yeah, for you, yes, for you.
That's
But
correct.
for me, I would say that time I only started to do.
Okay,
I would say like that.
one of the first. I mean,
Yeah,
I
one.
was
Yeah,
one
yeah,
of
yeah,
the first.
one of the
implant
first.
patients.
So,
No.
how is that?
Well, sometimes I think that it's better than my own teeth.
Why do you think so?
I feel it like this.
Okay.
I feel it like this, you know. That I afraid you guys. I really afraid dentists.
I know.
Yeah.
Yeah, that's we have a point, right? Like in your iPad Pro, we have a point fear, right?
Yeah.
We will
about the
discuss the
fear.
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 Yes, the
Fear
fear.
of dentistry.
Yeah, later.
Yes.
Yeah, it's
Yeah.
the big theme. It's a big point. We should discuss
Fear.
it.
why I don't go
You
to
are
dentistry.
you
Yes,
are that
I
person.
yes, I really afraid like a fire of you guys.
Yeah.
For me, I prefer to do the open operation for myself. Either I go to you guys. I don't know why.
Can you explain why?
Well, maybe because I had phobia. Because when I was a kid,
Okay.
you
This
know,
is
at
yeah.
that time,
It's everyone like
at
yeah,
that.
that
yeah.
time, the dentist I was like a punchers, guys.
As always,
You know,
everyone,
like
got
pinchers.
a,
I mean,
yeah, everyone got a trauma when he was a kid. He has got like like government polyclinics, and then
yeah.
somebody
Open your mouth
open
without
your
without
Yes,
nothing.
yes,
without
yes.
anesthesia,
Open.
somebody
Yes.
extract their
Might be,
tooth,
yeah.
Yes.
and like it's like
But I get phobia not
childhood
because
trauma.
yes, I don't have the problem because of the dentist himself. I went with my father, and when I don't want sit on the chair, my father punched me on my face. You know, this is
Traditional
traditional.
Uzbek,
Yeah,
traditional Uzbek method.
Yes, anesthesia.
Okay.
Punch anesthesia, right?
Punch anesthesia. Yeah. Well, this is the fear. This is the fear. You know, but okay, maybe the another point is because I'm doctor, and I know the mechanism how you go.
How it works.
Yes, how it works. And so every of your manipulation I can imagine. Okay, what you do
You are
now.
just overthinking just about it, right?
Correct. Yes, correct. This is my personal fear actually. Yeah, that's
Because
But for
nowadays,
us, the best
yeah.
patient is who, Nuruddin. I think you'll be agree with me. For us, the best patient is who? The person who just came to us, just have a seat, just close their eyes, just listen to good relaxation music, and just believe to his dentist.
okay.
Just give him or herself to doctor and just have a
Full
sleep.
trust.
Yeah.
Yeah, I agree with Sarwar. We like these patients, but for me personally, if I have complicated patients, such as like fear or which I would say like we have a Google patients
Okay.
who
knows everything,
who
eh?
knows everything.
Smart
No,
patients, right?
they are who knows everything,
But
but for me, I would say this kind of patients, everything it's complicated. But with this kind of patients, we are growing up. We are
becoming stronger. You know?
becoming more strong.
Yeah,
We are
everything what is not
with
killing
with
us.
with a fear
make us
patient. Sarwar will agree with me. Recently, 2 days ago, we talked about it. Like personally, we are like individually, we are checking everything. Like this is like a sensitive patients. It's like from the opening just the mouth, just from the checkup and the finishing work, we are controlling everything. From the mouth to the
To
like
whole
we to whole body we're controlling. Like during the work, like sometimes patients cannot say something like it's painful or something like that. They're just showing us like droge.
Okay. They start.
They're just showing
Yeah,
you the
Shaking, they start to shake.
shaking,
shaking their
yeah,
heads.
shaking, or they are feeling uncomfortable.
Yeah.
So these such as
We are feeling this, right.
situations we have to feel. We have to feel because we are not treating only the tooth. We are treating the patients.
Correct.
And I wanna
This
say,
is
yeah,
different
I'm
thing.
totally agree with Dr.
This is
Nuruddin.
different things.
The patients which are coming to us, for example, our patients for 5 or 10 years, these are long-term patients. They are choosing us, for example, me, in my case as dental, for example, Dr. Nuruddin, only for this, because we are giving, much. We are giving in details, like
You pay
they will like
attention
it,
for
yeah,
everything,
yeah,
yeah.
like a devil in details, right?
Okay. Yes,
Yeah,
yes,
yeah,
correct.
all of because we are giving all of, for example, all of patients, all of our attention to our patient. For example, if they are feeling some pain, we already know it.
Okay.
We're already asking, is everything okay?
Okay.
Do you have a pain? Or if you want, we can give you some more anesthesia and etc. That's why, for example, there are too many dentists nowadays. in every corner, in every first floor of our buildings is dentistry, right?
Yep, yes, correct.
Yeah.
Because as you said before, you now big conversation in the beginning of conversation that God's want dentists become rich.
Yep.
So everyone trying to become rich now.
But it doesn't work like this, you know. You are
Totally agree.
You are becoming a rich person, for example, only then when you give all of your attention, all of your energy to your patient.
Yeah, when you work
And
from
pa-
bottom of your heart.
Yeah, exactly. And the patient, every patient is feeling this. You know, for example,
Yes.
if somebody, if or some students, for example, I'm a teacher in Tashkent State Dental
Okay.
Institute, but I want to say to every student, for example, don't think that patient, don't know about this or just don't feel anything. Patients nowadays knows everything.
Yeah. Yes,
And
especially
the main
nowadays.
point is trust. For example, in my personal case, I'm not working with the patients who do not trust me. For example, I feel this chemical bond between me and the patient. For example,
It's very important
Yeah,
thing.
it's very important thing.
It's very important.
And I am, I get it from my teacher. For example, it's Dr. Nuruddin.
Okay.
Dr. Nuruddin, for example, teach me how to extract tooth, how to treat tooth, how to make root canal treatment, and
Okay.
etc. But as a student, I got from Dr. Nuruddin the soft skills, like conversation between the patient and
Subordination. and-
subordination, conversation
Yeah,
between the
this
patient
it's
and
very
the
important.
dentist and etc. Because soft skill is very important nowadays. You cannot just be a robot, like somebody
Okay.
has come. I have a pain, like okay, lay down, open your mouth, blah, 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 and etc. Okay, go pay money and go there. It's not working like this. You have to,
Correct.
you have to treat patients like you want to be,
Instead of him.
instead of him, right?
Okay.
Correct.
Yes, correct.
So,
What do you think about me as a patient? I'm a good patient or not? He was my
Just be-
doctor.
yeah, just give
no.
you trust.
Which Sarwar mentioned about we are giving our energy,
Yeah,
everything,
definitely.
such as patients. Honestly, I like such as patients only the after treatment, not the during.
Okay.
During, it's very difficult for us, honestly. It's very difficult because we are giving, which he mentioned, we are giving energy, we are giving everything, we are giving focusing, everything. But after that, patient saying like, oh, thank you. I found my doctor.
Mm-hmm.
I will not trust to no one. From today, I will come only to you. After that, you will feel like
You made something good.
You cannot.
Yeah.
It's difficult to explain.
The energy which
You cannot buy this feeling,
Yes.
Yeah,
So what
you
I want to
cannot
tell,
understand.
the energy which you spend it to your patient
You are-
after his result, when
Yeah.
he's saying thank you very much, your energy will be doubled.
Yeah.
Yes,
Right?
I would say
Definitely.
like that.
It's like,
Definitely, yeah.
Even it sounds like, some nasty, but I would say that it's like orgasm for dentists.
Okay.
Right?
Yeah. This is life. Yeah, this is life.
life.
Because you did something which couldn't do another doctor. You did that
Yeah.
thing.
You find the point.
Yeah.
You
yeah.
include
You-
all of
Okay,
your
I will be
energy.
nasty also. You find the point G, huh?
Yeah.
like that.
Okay.
So if we were talking about the doctors, in my opinion, let's compare for me there are two types of the dentists which you have to, the patients should understand. The first doctor is focusing on not only the treat only one tooth. Patient came just for cavity or with a gum disease, you did cleaning or you treat. It doesn't matter. You did something. And that first type of the doctor, he is focusing not only one tooth. He's focusing overall the body, how it's for the jaw,
Okay.
the teeth,
About the
gum.
mental health, right?
Yeah, everything. He's focusing everything, and this kind of patient focusing also in preventive treatments.
Okay.
and they are working in modern technologies. Like they are trying to work with a microscope. The microscope, I'm working for the 4 years. For the start, it's difficult. I understand it's difficult, but it's a good treatment for the patient. It's like
Yeah, you
comfortable, and you are focusing the magnification. I cannot show here exactly. I cannot explain what we are seeing on magnification. This is first type, the doctor. Second type of the doctor, like you come to the doctor, they're focusing on the one tooth.
okay.
You
So
know?
they do not
They-
pay attention
they-
for
they
your
are-
the
no,
rest of your health.
No,
They just
no.
okay.
They're just drilling your tooth. They're putting filling, or they're doing a root canal treatment. They're not focusing to overall your mouth health.
Okay.
They just
They don't
Do
even
it.
speak with you.
Okay.
yeah, just open your mouth. You have a cavity, or we have to extract your teeth.
We don't have too much time.
That's all.
Okay, lay down.
Yeah,
Lay
that's all.
down, let's do
Yeah,
it.
yeah,
and
let's do
out
it.
with
So
the
that's
Here's
exam.
the next
why
one.
that's
Yeah.
why it's important moment that patients should choose doctors widely.
Mm.
This is very important thing.
Okay, let's talk about the lifestyle. Both of you actually, because both of you are doctors and both of you want to become rich.
Rich, why? This is
No,
it's,
because-
it's very interesting. Why nowadays everyone thinking like only the dentist is rich? That's all.
This is the
before
mentality.
before when my father is dentist.
Okay.
Okay, that time there was no like such as words like
Okay.
oh dentists are he's
They're
rich.
rich, okay.
But nowadays, but might be, yeah, I agree with that. Yeah, our salary is high, our might be procedure is high.
Yeah.
But which we talked about it before, how we are giving our energy, how we are spending. In the evening,
Yeah.
you don't know how we are feeling, because after the work it's difficult. I mean, per day, me personally, I'm working with minimum like 3 or 4 patients, maximum might be 8 patients, but
Eight
each
patients
8, this is the maximum
per day.
per day.
It's too much. Even for me, it's too much.
No,
Okay.
no.
Yeah.
I'm telling,
Okay.
Yeah,
I'm telling
maximum.
the maximum.
Okay,
Maximum.
okay.
This
Yeah,
is the
thank you.
maximum,
Okay.
So each person taking one part of your energy.
Oh,
Of
totally.
your-
Yeah,
I will
yeah,
say
yeah.
more. Every patient, like taking your part of your life.
Yes.
Your time.
Yes, but on the back.
Not only energy.
Yes, on the back, they giving you the part of his life also, because he's trusting you and he's creating your life. I mean, he's giving you something. He give you a trust, and you are really responsible for this trust.
Yeah.
So you
Yeah,
you
for
doubled responsible. Okay. Now my question is about money or result.
Money becoming after results. This is my opinion. First, if you making the results, money will come.
Okay, but the personally, which is most important for you, the result or money?
You mean the procedure?
Yeah, I mean the you become
Result
a
of
doctor.
treatment, you mean? or
Yeah,
what?
yeah. I mean the result of the
result
treatment.
of the treatment.
Or the money is most important for you. You become a dentist because of the money, or you become a dentist
That's
because
another question.
no,
Yeah,
it's in the total. I mean in the total.
Now, in the total, if we will talk about in the total, before when we young, like 16 year,
Yeah.
for me it was my father was a doctor, so
Okay.
he just give me suggestion that time. So if you becoming
Advice or
advice,
okay, okay.
he give me advice. If you becoming as a dentist, I will support you. It means support me with education.
Okay.
I will. So from the second course, I started to work. I started just starting with the cleaning,
Okay.
the filling, everything. With the simple works. So then I understand. Slowly, I will become. I will answer to your question. So I saw a lot of doctors who are spending their life only becoming rich.
Okay.
But generally, after few years, we are comparing. We are comparing of our teachers. I mean, I had a lot of teachers. One of them worked only for the money, but I will not say their name.
Yeah.
But
Let's
second,
keep confidence.
yeah. Second doctor, he was not rich at that time, but he worked only for the result.
Okay.
It was 8 years, might be 10 years. I cannot say exactly the year, but nowadays, who planned to become rich, he's still on same level.
Okay, I see.
But who worked only for the result, not for the money, now his level high.
Okay, now
You
I
know-
get your point.
You know why? Because even in nowadays, when he's on the top, he don't think about becoming a rich man.
Okay, about material, you mean?
Yeah. That's why he's on top.
Okay.
Because it's not that it doesn't work like we think, like, I will become a dentist and then I will become rich. Nope. It doesn't
Because
work like this.
why I'm giving this question? Because you know everything in this world is supposed to be paid, and the
Yeah.
energy which you are spending and the love which you're spending and the time which you're spending to the patient is priceless. This is the priceless.
Yeah.
You know, that's why the question come to my mind is, so you're supposed to get the price for what you're spending, or you're supposed to get the result for what you're spending? So this is my question. What is important, the price or the result?
I think, in my point of view, for example, I think it's the result, being honestly, because first of all, we are doctors,
Yes.
right? Me,
Correct.
you, Dr.
Yes.
Nuruddin.
Yes.
And then we should think about, like, material things.
Okay. So if the patient come to you and will tell to you, I don't have enough money for your treatment, you will treat him without thinking about material.
Yesterday, we with Dr. Nuruddin talked about them.
It's a good question. Yeah, it's a good
If
question.
you remember, yesterday we talked about it. Yeah?
Yesterday we talked about it.
Yeah. For example, if the patient really doesn't have money for the treatment, we will give, like, first aid.
Yes.
Okay, just first aid. And then, for example, you have like, I don't believe that nowadays the people doesn't have too much money for the treatment, because everyone have iPhone, right?
Well, maybe.
May I let me the answer for this question?
Yes,
We'll
go ahead, go
continue. So from my case, I think it was last year in Dubai came one patient. It was an Indian guy.
Okay.
He just came. He didn't check anything. He just came and he just sit, and he's not talking in English.
Okay.
He has one
Translator with
translator. Yeah,
Okay.
he's translating like he has just a pain.
Okay.
Okay, I'm just opening, and I'm seeing he cannot afford our clinic.
Okay.
Okay, he didn't check our prices.
Okay.
So what I did, but he has a pain. I took X-ray.
Mhm.
First of all, which he mentioned. First of all, we are doctors.
Okay.
First of all, this is very important. We are
Yes.
doctors. So I took X-ray, and we have a patient has inflammation on the pulp,
Okay.
pulpitis. So we have to do root canal treatment.
Okay.
I asked them, so what we will do? He told, okay, how much it will cost? So I told, this reception will charge
Okay.
this
amount.
Price,
this this amount. He told, oh, I didn't check the price, so what we gonna do? Immediately I told how we can cancel the procedure. You're sitting here, you have the pain. How I can let you go out? So with the pain.
With the pain,
So
right.
first, we are doctors. So immediately we start the procedure. Immediately because emergency treatment is very important. So emergency things we are doing for free sometimes. If patient came, if patient showing he has a pain, how we can cancel the procedure because of the money.
Right.
I did the root canal treatment because of the
Humanity.
humanity, you know.
Yes, yeah.
Patient has pain.
Yes. So
I
because
did-
we are human.
We are human. Yeah. I did root canal treatment. I put temporary filling.
Okay.
After he told, I told him, next procedure it will be
Much more
much more expensive. Yeah. After
It won't
that,
be free, right?
Yeah.
yeah. After the patient will choose the clinic he can afford or no. So these things we have to do. We are
But
doctor.
you know, I would say to use one thing. I think Nuruddin will support me in this thing. In many cases, the people who has not too much money to afford, for example, your treatment, they always say, "Okay, no problem. I will like collect my money and come to you."
Yeah.
And you know, the people who has not too much money are the braver than the people who are rich. For example, they didn't ask, for example, in my cases, they didn't ask for example, for a discount or
Okay.
something like this. They just come with, okay, doctor, how much it will be cost for my treatment? I said, la 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 la. Okay, let's do this. Just give me, for example, 1 week or 2 weeks.
Okay.
That's the main point.
Okay. Maybe because of our mentality, I guess. It's only because of our mentality. Okay, because I didn't use. Okay, I worked as a doctor in Kazakhstan, in Russia. I worked as a doctor in here, so I have 3 countries in my pocket where I worked, and I found every country similar. I mean about the mentality. So I can agree with you that sometimes the people who is not rich enough, it's acting more braver
Yeah,
than the people who is rich enough.
100%.
Okay, but what about Dubai?
It's complicated.
It's complicated,
Why?
right?
Because we have patients, I know, from the Russian, from
Worldwide
Uzbekistan,
patients.
Yeah.
right?
Worldwide patients.
That's why this
International.
suggests things I cannot say, because I would say like it depends on the person. It's personally, it's individually, because we have a lot of patients which we talked about. I'm saying just sensitive patients, good patients, or affordable patients,
Yeah,
like
look,
that.
look.
Yeah.
This is the
For
point.
me, yeah, for me like
this
that.
is the point of Dubai. He's saying that I have sensitive patients, I have affordable patients, but here we start from we have rich patient. Did you get what I mean?
Mhm.
In Russia, for example, in
Yeah.
Kazakhstan, same. The rich person, the poor person, and the medium person. You know, this is the difference between the countries, because in Russia the same. In Russia, say, this is the VIP. You're supposed to be really careful with him, and
Give them VIP service,
yes,
right?
service.
No,
And
yeah.
that guy has not enough money, so you can treat. This is the difference between the countries. It's really interesting.
No, in Dubai everything is different. Suggesting is different.
Because in Dubai, two kind of persons, you know, who is living as a rich, and the second kind of person who
Who
is
is surviving?
no, who is coming to see how the rich are living.
Okay. Okay.
You know, they just watching. They can do nothing.
Locals and visitors, right?
Yeah.
Okay.
Okay, let's talk about the Veneers.
Yeah.
Veneer case.
Okay, veneers it's near to implants. I mean, it's the same like implants.
What do you mean the same?
I mean, if I lose the teeth and I want beautiful teeth, I put the implant, then on it I put the veneer,
No.
or how it works?
No.
So Dr.
No,
Nuruddin specialized in veneers, so
Okay.
I think he will give you more, more good answer than me.
Information.
Yeah, more
No,
information.
for the veneers, we have to understand that veneers and the crowns and the filling, not the filling, veneers and the crown. For the crown, we have to prepare hold the tooth.
Okay.
But for the veneers, we are preparing only the facial side, and we are keeping healthy the tooth. But you're asking me about the implantation. On the implant, you lose your tooth.
Yes,
okay,
correct.
and for sure you don't have option to put the veneer on or the crown. For sure, after
Different things.
implantation,
Okay.
you don't have another choice. You have option only the zircon crown.
Zircon crown.
Nowadays only the zircon
You can
crown.
make it beautiful. I mean, you can make it
No,
closer as a
no,
veneer?
no,
I mean,
yeah,
because
yeah.
as I understand, the veneers are the
With
Hollywood
one word,
smile,
the natural.
Yeah.
I would say natural.
Okay.
Yes, with the zircon crown, you can achieve these results. Natural, you can achieve because nowadays on the zircon we can layer the ceramic.
Okay.
With the ceramic, we can play the colors, the matching the tooth color, or I mean your natural tooth color. We can achieve with that. So I would talk about the TMG problems, which we talked before. Not the problem. We talked about the growing,
Okay.
the
And I think
supporting
it would be
everything.
good if you will mention about the, form of the veneers. For example, Dr. Sardon don't know how it looks for zirconium crown, 360 crown in just veneers. What is the difference? For example, veneers just like laying for the vestibular
face side,
surface.
yeah?
Yeah, face
Yeah,
side.
on
side.
the face
Yeah, I
side.
think you
Veneers.
should mention it
Okay,
because
okay,
I
okay.
think for your patients, for your future patients, it will be more interesting.
I thought I
Yeah.
thought that veneers is also 360. That
No.
it like
No.
like the bottle on top. They put inside. I thought
Like a
it's like
cup.
this.
Yeah.
Like a cup, huh?
No,
Just
this is
say
not.
the
this-
benefits and advantages of the veneers instead of the 360 crown.
Yeah, this is main point of the veneers that we are not preparing the whole tooth,
Okay.
which I mentioned only the facial side and not the tooth. We are preparing only the enamel tooth structure.
For example,
Which-
I have to say that when Dr. Nuruddin says preparing, he means drilling.
Okay.
Right?
Yeah, drilling,
Mhm.
drilling,
Okay, okay.
drilling. We are drilling only the enamel structure. We are we are keeping the 70% the enamel.
Can
We're
you show me on it? You say
Here, this one is not the natural tooth. Here we cannot see
Let's go for this.
No, I mean here we cannot understand which surface is the enamel. Enamel is like first layer.
Okay.
Here we cannot see.
Okay. I
So
see.
first layer it's very thin. Might be we will show here.
Okay, on the picture, yeah,
On
yeah.
the
Just the
picture might
surface
be
of
yeah.
this,
It's a surface of the tooth. Might be we'll show. We can do it.
It's it's 0.3, 0.4
Yeah, it's very
millimeters.
thin.
Millimeters.
Li-
Oh,
very,
yeah.
very
It's
thin.
very thin.
You can just
the-
you cannot see the difference.
Okay.
You
But you
know-
can feel while the drilling.
Yeah.
We can feel.
We
I mean,
can
you
not
feel
the
can
patient,
feel.
right?
No,
Okay.
we are working with magnification, with a microscope. We
yeah,
can
yeah,
control
yeah.
everything.
Okay.
You
That's
know,
right.
if some cases, if we have to add for the size, I mean, size of the tooth is small. And we have to, we are planning to change the size. I mean,
Okay.
we have to make like bigger.
Okay.
If we have spaces between the tooth, some cases we are doing without preparation. This is
Yeah, tell us
very
the
good.
cases without preparation, without drilling, Dr. Nuruddin. For example, the gaps between tooth, right? Which we say mediast, I would say
Trauma.
tremor. God damn it.
Our English, assalamu alaikum.
No,
no, it's
not
not
English. It's the same. It's Uzbek seems same.
Trem and how it's called.
It's okay. The space between tooth.
Okay. The
Space between
mind
teeth.
the gap between
Gap,
the
gap between
gap. Yeah.
Gap between the
between
teeth.
two central tooth.
Okay. Mind the gap between the train and the platform. You mean the gap, huh?
Yeah.
On metro they're saying like this. Mind the gap.
Mhm.
Okay. So the gap, you mean the gap between
Gap.
two
Yeah,
teeth,
between the
right?
tooth. Yes.
Okay.
Such as cases, not every time we have to drill. Sometimes it's everything is ready. We are just taking the impression, we just agree with the patient the future. We are making the temporary veneers first, and we are discussing with the patient. If patient like it, we're just directly we're taking the impression. and
Yes,
preparing.
time.
Yes.
Yes, time.
This time,
Okay,
yeah.
Okay.
So, and what I wanted to discuss with the Dr. Sarwar about, he know my first of my veneers case when I did when we didn't know about TMG problems, such as bruxism.
Yeah, I remember this case.
Um, yeah, he know this.
It was our
that
first
Bruxism
experience.
is when you're scratching the.
Yeah,
Yeah.
exactly.
Okay.
Scratching.
okay.
Yeah. My first patient was patient with bruxism, and I was young, and this is my first case with veneer. I just I just drilled the tooth and just take an impression, and I just put the
Just
veneers.
for information, it was like 10 years ago, right? 10 or when it was?
More,
2014?
Yeah, like that.
Yeah.
10 years.
For
10 years.
example, first veneer patient for Dr. Nuruddin, it was like 10 years ago.
Okay.
Yeah, that times we worked together, and after bonding, after putting
After fixation.
after finishing the case,
Yep.
the case, in a few days, patient coming back with
Broken
cracking. No, not the tooth.
Okay. The veneers.
The
Yes, yes.
veneers coming out.
Wow.
We cannot understand. Might be I'm thinking might be I did something wrong with the protocol of the bonding.
Okay.
Might be in simply I will say like gluing
Okay.
the veneer on the tooth.
Cementation of.
Cementation.
Yeah,
It's
yeah,
simply cementation. Might be I didn't follow some rules. Might be, and I just put back. And this patient start to come for us for might be for 6 months. Every week he's coming. Every time he's calling me, I'm shaking every time because
Yeah, you have responsibility. For
yeah,
it.
this is a responsibility. Patient also might be he's
Yeah, because you know why? Because we took too much money for this. That's why.
At that time, you wouldn't think about humanity, yeah?
Yeah, it's a joke.
No,
Okay? It's a joke.
no. What is my advice for young doctors? First of all, they have to learn how to do. After that, we have to start. But before that, honestly, in our country, we didn't have good doctors, good teachers for the veneers. We just read on the books, and we just saw on the YouTube how to do it, and that's it. We just started to work.
Even in international,
Self-study, yeah?
even in international arena, for example, worldwide, in America, in the United States, right, or in UIA, it wasn't such a,
Wasn't such as information about it.
yeah, we didn't have such much information about veneers, first of all. In dental clinical cases, for example, nowadays veneers are very famous, right?
Yeah.
But 10 years ago, it wasn't famous like nowadays.
So after that, not after that, after few years, I understand that all this chipping, veneers coming out, all this problem cause our TMG. How patients sleep. I remember at that time that patient calling me morning time. What we are doing at night, we are grinding. I mean, the bruxism patients, they are grinding at night.
Okay.
During the day, they can control it.
Okay.
They can control. And then I understand. This one I am understanding after few years.
Okay.
Then I understand that I have to learn TMG problems.
Okay.
How work with a bite.
Okay.
If something wrong, might be some cases we have to increase the bite. I mean, we have to put the jaw in correct position. And we have to give to patients night guards. It's like a thin...
protecting caps.
Yeah,
Okay.
a simple
Like
protective.
boxers.
Like,
caps.
like boxers
simply,
caps,
yeah.
right.
So this one will, first of all, it will protect at night your veneers. During the day, patient will control it.
Okay.
And with increasing the bite, we can, if we put the jaw in the correct position, I will not say like we can treat the bruxism. Bruxism, it's a very complicated disease because it's connected with the nerves.
Yeah, it's
the
very
muscles.
complex disease.
It's honestly, it's very complicated. This is, I would say, should treat not only the dentist.
Okay.
It's a relative to the
Other side of medicine.
so
Neurology.
from our side, we have to to put correct diagnosis and take 3D X-rays, everything to check the jaw position. And with increasing the bite, we have to put to the correct position.
I see.
After that, we can start to do the veneers.
Okay.
And for sure, we are giving the night guard. As a dentist, these things only we can do only these things. Other things, it's we have to send to.
So
an-
that's why
another
nowadays that's a big problem, Dr. Sardar. For example, let's take an example, like in example, Dubai, for example, right? For example, you just moved to Dubai, you
Okay.
have some kind of money, I don't know, maybe 3 or 4K
Okay.
dollars, and you want new smile, right?
Okay.
You're just searching someone in Instagram, like for example, some Veneers UIA, right?
Okay.
And you find somebody, for example, Dr. blah blah blah.
Okay.
Okay, he made everything like very luxury, you know. Every patient of him.
So his
like-
marketing guys are good.
yeah, marketing guys are very good for him, but he's not a good doctor,
Okay,
like
I
good
see.
specialist, right?
Okay.
And what you do? You are just going to him to his clinic. You are just try to trust him, but his goal just take your money and give you just new, you know, bleaching white tooth, right?
Yeah.
And just go. And you just take what you take.
Okay.
This doctor, for example, doesn't think about your TMG problems, about your bruxism. He don't even, you know, take from you your previous diseases. For example, do you have a problems with your dreams at night, right? With your neuropathology system.
Yeah.
etc.
He's
So-
not. Yes, he's not taking care about your
Yeah,
background.
yeah,
Yeah.
yeah, anamnesis.
Anamnesis.
Yeah,
Yes.
yeah, it's we said in medicine,
Yeah, yeah.
anamnesis, right?
Anamnesis. Yes.
And that's the main point. For example, that's why my advice to you know, future patients in UAE, just search carefully your
Yeah.
future dentist, because it's really important.
Yeah. Your health is not to come to
Yeah.
the shop and buy a
Yeah,
new smile.
Yeah, for sure.
And don't choose, you know, the cheap one,
Yeah.
because at my 31 age, you know,
Yeah.
I didn't see even the one case when the cheap thing, you know, like worth it.
Yeah. You know, there's a UK. I mean, Englishman used to say, "I'm not rich enough to buy a cheap stuff."
Yep,
Mm.
that's correct.
Yeah.
Yeah, this
we
is correct. Yeah.
Don't be cheap enough. Yeah.
Mm.
Yeah. It was really interesting.
Okay, guys.
Okay.
I think today we talked a lot about
Yeah,
the
we
good
talked
things,
and
about not good things. We talked
about nasty things.
about everything. So
Yeah, that's right.
I think it's time to finish our the discussions.
But it's our first conversation. It's our first discussion, and I really hope it's not the last one.
Inshallah.
And
yeah,
inshallah,
also for
we're
that.
gonna keep update our patients with the good information.
Yep.
With the good information. I mean, for your patients, Dr. Sarwar,
Yeah.
Dr. Nurdin, my patients also.
Yeah.
And yeah, thank you very much. Thanks. I was really enjoyable.
Thank you. So I have to mention one thing. Today we are filming in Tashkent, in Uzbekistan, right?
Yeah.
And I hope our next podcast will be in UAE.
Inshallah.
Inshallah.
I hope that Dr.
We'll hope-
Nuruddin will invite us.
We'll
You know,
invite-
yeah. We'll
Inshallah.
send for us business class tickets for Uzbekistan oyunları.
Inshallah,
Yeah, you know, book for us Burj Al Arab, and we'll go for the second
Inshallah.
podcast in UAE. Guys, I'm being seriously, thank you for having us, for having me, for having Dr. Nuruddin. I think our conversation was good.
Yeah.
First time, I think it was good
It was
Yeah, for
it
the
was
first time.
really first experience,
Yeah.
really good experience
for all of us.
for all of us.
Yeah,
Yes.
and
Yeah.
I think, you know, much of it, you know, will be good experience for our patients, right? To
Yes.
get more and more productive information from our podcast.
Yeah, and maybe we try our next podcast to make in other languages also. Maybe the next time our English will be. Will be a really good case to improve our English.
Yeah.
Our English?
Yes, I mean, our
to improve our English skills.
Yes,
Yeah.
skills. Yeah.
Yes, for sure.
Для тех, кто смотрит с нас, я
Смотрит,
думаю,
да.
многие из тех, кто нас смотрит, ребята, вы Я думаю, владеете узбекским и английским языками, и русским языком также. Поэтому...
И языком, в принципе.
Я думал,
Guys,
для
guys,
сегодняшнего нашего
guys, it's
подкаста...
time. It's I know we are enjoying, we are enjoying, but it's time. It's time to say goodbye to our discussion. Thanks a lot, Dr. Sardar and Dr. Sarwar, to come for the invitation, for the discussion. So inshallah, I will hope it will continue. We will not stop. Only we will invite another doctors or we will just it's first challenging. So
Time will
Yeah.
change. Time
Yeah.
will show.
Time will show.
so
I will
inshallah.
say,
So I hope that our conversation was helpful for our audience. So we will hope in the next podcast it will be more interesting, and might be we will mention about, might be it will be in other languages such as like in Russian, or we will see. So time will show. So we'll see, might be in English. So thanks for everyone, guys. If you have any questions for us, for me, for Dr. Sardar, for Dr. Sarwar, if you have any questions, you can write on the comment section, and we will try to answer your question.
Thank you for
Thank you
everybody.
very much.
Thank you so much.
Thank you for your attention.